Tonight's webinar is about chronic pain. And we're also going to dive a bit into chronic illness, because chronic illness is equally, sometimes directly related to the chronic pain. And we're going to hit both those together. We'll be discussing America's healthcare crisis and why it's a crisis, but also what's great about healthcare in America and how they should be coming together and what we can do to fix that problem since they aren't. We're going to discuss how we can make some lifestyle changes to make sure that we can start feeling better, and not just feeling better for the short term, but for the long term. I mean, long term being forever. Inflammation is going to be a big topic of what we're going to discuss tonight, because it's one of the main pain generators. And we have to find out the reason for the inflammation so we can calm that down and then eliminate it so our bodies can heal and we can feel better and we can start to enjoy that quality of life that we deserve. Be patient with what we're going through tonight and have an open mind. It's going to be new information. Our Western medicine mindset has trained us to accept certain procedures as the norm. And tonight we're going to talk about a different system that can shock the system so we can move forward in a different direction. So we have the ability to heal, and most important, teach others how they can do the same. So I'm really happy that you came tonight, or you're spending this time tonight with us to learn how to better yourself. And I promise you, I'm going to give you everything I can over the next 45 minutes to help you learn how to help yourself. So let's move into the presentation. The quote of mine that I love is from Winston Churchill. And when he speaks about his island in this quote, I think about my own body, because I suffer with chronic pain as well, which is why I'm giving this presentation, because I have a wealth of information to share with you as a result of the reality of my own challenges. And when Winston Churchill talks about defending his island, whatever the cost may be, we shall fight on the beaches, fight on the landing grounds, fight in the fields and in the streets. We shall never surrender. Why would one talk about a World War II quote for a chronic pain webinar? The point being is that we don't have a choice or an option to surrender when it comes down to what we're up against in trying to manage our chronic pain or chronic illness. And we must defend our body, and our bodies being the island. And fighting against all the bad information or the people that are trying to service us that may not be helping because they have the wrong information, or it's just a model that's broken. We have to fight against that because we will never surrender. To me, it's a very powerful quote, and I'll come back to that time and time again. To fight a vicious army, you have to have an amazing team. And fortunately for us, we certainly can't get all of our clients better with one individual. And we have a great team around us. Sam is off to the right, and Sam is our wellness coach expert. He is our biohacking expert. He has all the answers for the up-to-date knowledge we need to get you better. Jessica, big place in my heart for Jess. She is the only non-therapist in our group. So when all therapists tend to go in their doctor box, she says, you're not thinking of the eyes of the patient. And she spins it and brings that empathetic approach to make sure that we know that we're going in the direction of patient care and getting that individual patient to their said destination. I am next to Jess in the gray shirt, and I started this company 21 years ago. And the primary purpose was to get people out of pain so they can enjoy their quality of life and be active. That spiraled into starting to work with professional athletes and pro teams and the Olympic Training Center, but I was missing something. I wasn't helping people from inside out. I was simply working on their injuries and their scrapes and their boo-boos and their strains and sprains, but I wasn't fixing their internal health. So I only had half the puzzle. A decade ago, I made a shift and we started using functional medicine, and we started treating people from inside out as well as their injuries. And now we have an integrated sports medicine wellness practice that is helping so many people better their quality of life. Patrick is off to my left, and he is our regenerative medicine specialist. He is when somebody has a degenerative condition or arthritic condition and limiting their ability to do the things that they love, Patrick steps in and we discuss stem cells, PRP, prolotherapy, or hyaluronic acid, or a combination of all of those to make sure we can minimize the pain and regenerate tissue to enhance that quality of life. I'm very proud of this team, proud to call them partner. So tonight, what we're going to cover, well, we discussed what we're going to cover earlier, so we're not going to go over it again, but we are going to discuss the 5 pillars of health, or more importantly, 5 pillars of success, because I'm sure some of us have tried 1 or 2 or 3 of these pillars, but maybe not put all of these pillars together. And that's what makes us different, and that's what makes us successful. So nutrition, detox, hormones, fitness, and mentoring all must come together, one not being more important than the other. And that mentoring part and coaching part, I believe, is so necessary to make sure one of those pillars don't trick away. And we're going to talk about that as well. So in defining America's healthcare crisis, this is a Medicare quote. And we're going to start tonight off with a negative, because I want to spin this off into a positive as we go, because this should be a positive conversation. But when Medicare, who is a governing body of all insurance in our country, so it doesn't matter if you're using Medicare currently or if you have a PPO policy or HMO policy, this is a guideline where care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. And for somebody like myself who is currently a sports medicine practitioner that works with enhancing people's quality of life and to prevent injury and prevent disease and maintain and promote health, to read this is infuriating for me, which is one of the main reasons we're having this conversation tonight. Because I believe healthcare in our country is amazing. When it comes down to healing people that have acute incidents, such as heart attacks, strokes, fractures, dislocated hips, because that's what we're looking at right here. One of my closest friend, Ed, he's off to the left. He's obviously skiing and having a great time. Unfortunately, Ed took the last run of the day. Of course, it always happens. Blizzard conditions, down a black diamond, hits a mogul, dislocates his hip. If anyone out there has experienced a dislocated hip, I'm so sorry you had to suffer through something so horrible and painful. It is one of the most painful things you can experience in life. But fortunately, we have ski patrol that can come and save the day. And fortunately, we have medication that can get people out of pain, because they injected Ed with 5 shots of ketamine to get him out of pain so they can transport him down the mountain to the emergency room, to trauma care, so they can put his hip back in the socket right there on the spot. There is no other country I want to be in except for the great United States of America when I dislocate my hip on a mountain. Now, the challenge is that that's a 2-hour process. This whole process right here is 2 hours. The challenge comes when they release Ed from the hospital. What does Ed do then? Unfortunately, Ed's hip is in an inflamed state. It starts to degenerate, it affects other parts of his body, and he begins the process of managing chronic pain for the rest of his life and falls into a system that I think a lot of us tonight are experiencing. Thankfully, we found Vicky, and Vicky is one of our wellness clients, and she was nice enough to write this testimonial for us, and I was shocked to get it, and when I got it, I was so pleased to see what she wrote, because sometimes you don't realize the impact you're making. So Vicky came to me because she had chronic pain in her neck causing headaches, into her shoulder and down her arm. She couldn't sleep. I'm sure some people can relate to that. And she had pain in her hip and her lower back. And she needed help. And this is what she wrote to us. My mother, who has recently died, suffered with chronic pain from rheumatoid arthritis. She was on every kind of pain drug known, including the strongest dose of fentanyl patches and sleeping meds, none of which touched her pain. I'm 68, grateful, and so wish my mother could have known Fixed Body Group. I signed up with Fixed Body Group to see if I could get some relief. At the same time frame, I had an appointment with an arthritis doctor who immediately wanted to start me on drugs. I put the drugs off, not wanting to follow in my mother's footsteps. So when Sean said, I want you to go on our wellness program, I thought, here's my sign. Here's my opportunity to get myself on the right path to getting and staying healthy, to be able to enjoy a retirement that we work so hard for, and to be able to be a part of my 4 grandchildren's life. Especially in this crazy world we live in now, it's even more important to have good health, and be there for our families instead of being a burden. I lost 15 pounds and feel like I'm in the best shape I've been in the last 25 years. I have energy, no pain. I sleep at night, which is huge, because I used to be on sleep meds. I love and so grateful for the wellness program, how it changed my life and health. And for Vicki, the way that we helped Vicki is we looked at her diet and we said, that cannot happen when you're in the pain that you're experiencing because you're inflamed, and we must remove and eliminate those foods. We can reintroduce potentially at some point. Your toxins that you're taking into your body, we have to take those away so your organs have a chance to filter and heal your body. We also have to remove those toxins so your hormones can do the job that they need to do. And we got to get you working out in a way in which your body can tolerate. And I'm here to coach you. And all those ways, those 5 ways is what helped Vicki over 2 to 3 month period of time achieve her goals. And she's well on her way to happiness with her grandkids. And I couldn't be happier for her. So, why won't my pain go away, or why do I have pain? And for this presentation, being as long as it is, we're not going to talk about why you have pain. We're going to talk about solutions for your pain. But we will spend a couple minutes on this slide because some people may not know that there are factors creating some of the symptoms that you're experiencing. Toxins being one of them, whether we're ingesting them ourselves through, let's say, cigarette smoke or alcohol or some foods that we eat that are cooked poorly, or environmental toxins. Obviously, injury, being acute or repetitive, can create this pain. Autoimmune conditions, rheumatoid arthritis, lupus, ankylosing spondylitis. There are so many autoimmune conditions creating chronic pain. Stress, being emotional and mental stress. When you're stressed at work or at home for whatever reasons, I think we all know we sleep less and our body hurts more. And inflammation is a big one, and we're going to talk about that more as we move forward. I wish I could, or I wish I could do what I did before at one point. I wish I could do this with my kids. I wish I could do this for myself. I wish I could do this with my wife. I wish I could sleep better. I wish I wasn't foggy at work. I wish I could just love my wife and be with her, or spouse, and be with her the way I was at one point. I wish I could recreate. I have a patient, his name's Tyler. He was hit by a car at 18 years of age in Mexico while he was on a mission for his church by a car as a pedestrian that was traveling at 80 miles an hour. He has undergone over 100 massive surgeries, a lot being spinal. He's lost a leg. He has no use of his left arm. He was 18 then, he's 47 now. There's a ring called the Aura ring that tracks your sleep. He sends me messages of his sleep patterns based on that technology, and he's been showing me consistent sleep patterns of 10 minutes a day at times. He's a father of 4 and a husband with a full-time job. That's called managing your chronic pain. That's not I'm going to get rid of my chronic pain. We got to find a solution to manage it for the rest of my life because I cannot surrender. I'm sorry for pointing, but that gives me that emotion that gets me out of bed every single day, knowing that I have the purpose and I have the solutions for people in that type of pain. And for me not to share what I know, that is a definition of selfish. And that's why we're here tonight. We all know Chris. Chris called you probably more than you wanted. Sent you a couple emails. I'm glad he did because you're here right now listening. And unfortunately, Chris, as our coworker, used to look like that guy on the left because he had chronic colitis. He had symptoms of severe abdominal cramping, diarrhea with blood in the stool at times, fever, chills, fatigue, joint swelling, skin inflammation, and what he said was the worst, he had no appetite whatsoever. And I said to him, if you have chronic colitis, do you think your body wants you to eat? Why would your body want you to have more food to process and have to eliminate through an inflamed colon? I'm like, let's get you started on our program. And he did. And in 2 months, he has not been back to the VA where he used to go 2 to 3 times a month to stay in the hospital because of this pain. And he hasn't been back to the VA in a year because we detoxified his body and found what foods worked as medicine. Not just because he wanted to eat, because he was hungry. We found the foods that would nourish his body and support tissue growth and heal himself from within. And for him to come work for us and have this solution, he is thankfully very bought into our program and our company. And so, Chris, you're right over there. You're working hard on fixing yourself. I'm glad we found you. So what's causing your inflammation? It's a good question. Do you smoke cigarettes? Do you drink alcohol? Are you on any prescribed drugs? Are you on over-the-counter medication? Are you taking any illicit drugs? Are you repetitively doing the same thing over and over again throughout the day, creating chronic injury? Do you have an acute injury that destroyed the joints in your body where now you're trying to figure out how you can overcome the pain biomechanically for the rest of your life? Is your condition autoimmune? Are you eating foods that are creating, I should make my face bigger for this. Are you eating foods that are creating a toxic environment for yourself internally where your gut becomes permeable? And when you eat those foods, because those toxins are eating away at your gut, little particles go into your bloodstream, or even fecal matter goes into your bloodstream. And naturally, your body has to create an inflammatory response and an immune response to fix that and eliminate that. Is that happening for you? Is surgery one of the things that you've been up against, or have you had multiple surgeries? There's a number of ways in which we can be inflamed. And most importantly, it's our job to teach you how to de-inflame and how to detoxify and how to re-nurture and how to get fit and have that support to make sure that you can be healthy. Because there's good inflammation. I promise you, you don't want to not have any inflammation in your body. But there's some real bad inflammation. And the good inflammation is when you scratch your eye or you have a chemical irritant irritating your eye. Let's say you cut your arm. You may have a burn. God forbid you get stuck on a mountain and you get frostbite. If you sprain your ankle, you'll see redness and swelling in that region. You may have an infection, both internal or external. That's when these inflammatory cells come and they fix the problem. They fix the problem. But when they fix the problem, they're supposed to go away. And if it doesn't go away, then you're stuck with chronic inflammation. And with chronic inflammation, we go down a downward spiral if we don't break the cycle of chronic inflammation, because the system should shut itself off. And if we go down a path where it doesn't know how to shut itself off as a result of repetitive injury, chronically irritating itself, repetitive injury, and chronic infections, an autoimmune condition, poor food or taking in toxins, and that system is chronically inflamed, we don't have a chance to win, and that's not okay. And it's not okay because it's an unknown for people. And being an unknown means it's not your fault. But thankfully, there's a system and there's a process and people that have gone through it that have proven that there's ways to decrease this inflammation in your body so you can feel better. This gentleman's name is Bob. I have a big place in my heart for Bob. You'll find out why in a bit. But arthritis is essentially, what arthritis is chronic inflammation in joints. So if the inflammation in your joint never goes away, guess what? You have arthritis. Bob, unfortunately, has a combination of arthritis as well as an autoimmune disease called ankylosing spondylitis. And for Bob, his condition started when he was 18 years old. And what happened was that these ligaments of his spine start to turn to bone. But it takes about 50 years for the spine and the ligaments of the spine to completely ossify or turn to bone. So from the age of 18 to about 75, this gentleman and many more are suffering in chronic pain until that fusion process ends. Bob's about 65 right now. And unfortunately, with our Western medicine approach and the healthcare crisis that we're in, we have a couple options. We have over-the-counter medication, prescribed medication, injections, nerve blocks, and surgery, a few others, but that covers most of them. And for me, if that's our option to treat an autoimmune disease that's fusing the spine without giving any other suggestion for hope or concern or care, because it is called health care, Bob, unfortunately, doesn't have an answer besides, we're going to keep you comfortable for the rest of your life, but we're not going to be proactive in taking care of your problem. And what that means is that they are putting a Band-Aid over, they're putting the Band-Aid over the warning signal. It's like, you have an issue, please help me, please help me, please help me. Never mind. I'm going to have some lazy leadership here and just simply not do anything about it besides numb it with some medication. Because I assure you, Bob is not going to get better from surgery. And Bob is not going to get better from a pill. Bob might feel better from a pill, but then Bob's going to need more pills down the road. And you know what that does to your gut? It makes your gut permeable, which creates leaky gut, which creates then fecal matter and undigested food particles entering your bloodstream, creating inflammation, enhancing the autoimmune response. We cannot have this. It is not acceptable, because when there are 5 pillars that can support a condition like this to get him to have a better quality of life, albeit said you cannot fix this, but we can help it. And he can have a way better quality of life if he had the answers. And I know I'm getting passionate right now, and thank you for allowing me to get passionate about this. It may come off as anger, but I assure you it's passion, and it's out of love to want people to have a life they can if they have the right answers. Because being proactive it's all about you helping yourself. We can't rely on the model. You can't rely on us, to be honest with you. You have to rely on yourself, but you have to have the right answers. And for me, why this picture is important for me is because this is my father. And my father has ankylosing spondylitis. He has what Bob has. My father currently is 83. And when my father was given this diagnosis, because he was also in pain at 18 years of age when it started for him, he fortunately had a doctor that gave him some really good recommendation, which was be active and be proactive. And he worked out every day of his life to this day currently, so he could have the life that he and his wife, my mother, deserve. And his kids, me being one of them, could enjoy. And he did a great job. Because right here, my father's about 70. There are very few ankylosing spondylitis patients that can have their granddaughter on their shoulders in a lake or dancing with their other granddaughter. And to me, this is legendary status because I grew up watching my father be in chronic pain and watch him fight through it without complaining one time. And he doesn't have nearly the answers that we have today to help conditions like this. So our pillars, how we help people and how we help Vicky and how we help Tyler, how we help Chris. It's through nutrition, detox, hormones, fitness, and mentoring. And we're going to get into that right now. Before we get into that, we have to ask ourselves, do we know that what we're putting in our body is not good for us? Or do we know that it's not good for us and we're still choosing to do it? Because if we are inflamed and it's creating the pain that we're experiencing, the chronic illness or the chronic degeneration or chronic pain, and we're choosing to make a choice, we're making a choice to ingest something that's toxic for us, that's the first step of tonight, is making that decision that will no longer happen. Food is ultimately that which is eaten to sustain life, provide energy, and promote the growth and repair of tissue. It is not meant to make sure that we're full and so full that it's painful and then eat another meal 3 or 4 hours later. It's meant to be pure. It's meant to be whole. It's meant to serve us. It's meant to repair our tissues and allow us to grow as humans so we can last on this earth as long as possible without degenerative conditions, and not just spinal degenerative or not just joint degenerative conditions, but autoimmune and chronic illness degenerative conditions. Because food can be medicine once we learn what foods agree with our body. If we are eating foods, if we're making a choice to eat foods that are fried, if we're drinking soda routinely throughout the day or any type of sugary beverage, if we're eating conventional meat products that aren't pasture raised, if we're eating barbecue food, which is, don't get me wrong, I love barbecue food, but it is one of the worst ways in which we can prepare meat. It creates so much inflammation in our body. And if we're doing that routinely, along with eating fried foods, along with sugary beverages, our gut has no chance of healing itself. And we have no chance of beating the inflammation. And we must start with identifying what's good for you, what type of foods are good for you, and eliminating the ones that we certainly know are not helping you move forward in life. Detoxification is extremely important. Chris, do you have something for me? Sorry about that. So with detoxification, that can mean a lot of things. When we look at this picture, I was kind of on the fence on putting this picture up because it's organs. Nobody wants to see this. However, it shows the liver, it shows the spleen, the lungs, and it shows your intestines. And these organs must be functioning well for us to be able to actually process our hormones. And so those hormones can do their jobs. And for our systems to regulate so we can also detoxify and filter. But without us going through a filtration process of our own, because we've damaged our body so much to this point, we need to give the body a little bit of a push, which are typically called supplements, to allow us to fast forward this process because the system can't do it on its own currently. But once we're able to flush the system and detoxify our body and decrease inflammation, the supplements aren't as necessary anymore, if at all, because now our system is doing job on itself. It's healing itself. It's filtering the blood on its own. It's using this pure whole food to be that source of nourishment and medicine to get ourselves better. And this part is really exciting for me because when I take somebody that doesn't realize how they're detoxing their body, if I can say that, and then teach them what toxins are going in and how we're going to get them out, it's almost overnight where these people start to feel better, sleep better, they start to move better. And man, that motivation is so exciting to watch when people start to get into other modes of recreation and just higher energy and most importantly, being fun to be around. Because the last thing any of us want to be is a burden. And if we're a burden for reasons where we can fix things quick, that is unnecessary in life. Hormones for me is a frustrating point because a lot of people have tried a lot of things. And I know you're not here. I know I'm not the first person here talking to you about how you can help yourself manage your chronic pain. I hope I'm the last. However, people miss this one pillar, and this pillar is very important. Because if your hormones are not balanced, or we're not doing the right tests to identify whether or not these hormones can help us get better, and I'm not saying just within the range of the normal American range that we have used to compare all of us as humans together, but the range in which you want to be functional and optimal, if we're not seeing these results and adjusting what we're doing to make sure we get those levels to where we want them to, then the fitness, the detox, and the nutrition, and no amount of mentoring is going to help us. So do we want fat storing or fat burning hormones? Most people would say, give me the fat burning hormones. And I'm like, we need both, and they need to be balanced. And let's look at the results in the lab so we can make sure they are. And let's get them to a high number when it's going to be something that's going to help us be more energetic and functional and allow us to recover better and heal better. You may see some body types. You may see some of these body types of your own. You may see yourself in this picture, or you may see people walking around and recognize this type of a body type. But when you see the person off to the left, we know we have an imbalance in estrogen in this human being. Person to the right has an adrenal issue. And we can simply see that by looking at this individual. She has smaller legs, not as much fat or muscle around the legs, but more around the midsection. And then thyroid is a condition. If there's a thyroid imbalance, you're going to get kind of a global spread of weight distribution. And we've all seen the beer belly liver distribution. Because with a poor diet and inflammation and fat on our organs comes something called organomegaly, which is an organ that grows too big, which distends the abdomen, which is what you see here on the far right, which is the liver presentation. All this comes together if we can stay active and our body starts moving, and it moves in a way in which your body can tolerate. And people ask me all the time, what can I do to get out of this cycle of exercise where I'm not making a change? I plateaued. If anything, I'm regressing. And the truth be told is I have no idea, because I don't know what your limiting conditions are. And we have to adjust those for what you're capable of tolerating so we don't increase your pain by being presumptuous that you can tolerate a certain workout. That's why it's important for us to get on a phone call where I can spend 15 minutes with you to hear about your story so I can understand what you're up against, so there can be proper recommendations for you to move forward. And we're going to discuss that shortly, because we have what we call discovery calls where I can learn more about you, where it costs you absolutely nothing, where I can sit down for 15 minutes, oftentimes a half an hour, to figure out what you're up against and is our approach right for you. We're going to talk about that in a few minutes, so please stay to the end. But fitness is really important, and I don't talk much about fitness because it is case specific. But my motivation for you today, if you want to take something away tonight, would be get moving, Do something different every day, even if it's for 10 minutes. It's going to make a huge impact neurologically and physically on your body, and it'll be a great jump start to get you moving forward and correcting your chronic illness or chronic pain. Because all these things don't happen without a mentor, because it's so easy to let one pillar go away. And for myself, who has suffered with chronic pain for over 25 years, and for myself to see my father, who's been in pain his entire life, and know that there's no excuses besides keep fighting every day and never surrendering to the challenges that we're up against, knowing that if we keep moving one foot in front of the other, we can do great things for ourselves and for other people. And in doing so, we can help ourselves not be a burden to others, and hopefully learn enough to educate others that might be in similar condition that you were once in. And that's called giving back. And that's what I hope I can help people do, so we can all grow together and enhance each other's lives. We spoke about this earlier. These pieces are fractured. And if one piece feels like it's too much, and the other three are easy and you enjoy doing those three, but that other one piece is something that doesn't, it's just like, I think I'm going to be okay without it, the system's not going to work, and it's not for you. We must bring these pieces together. Nutrition, detox, hormones, fitness, and mentoring must all come together, and that's what makes us different, and that's what makes this solution and this system effective. And there's no other way. We've tried, and I've tried, and this is the solution. We have to bring these pieces together. We must make sure that we follow a system, and you have the right team around you, making sure you push forward through those hard times, and you know that you're not there by yourself. And that's what we do here. I'm so happy that you guys have spent this time with me. I wanted to leave some time for questions and answers. But now is the time to make a decision. Is it the time to sit down and express your story to an individual that's going to listen to you, that can understand what you've been up against, can hear what you've done in the past that hasn't worked, and most importantly, what you want to do in the future, and who you want to become, and how you want to live the remainder of your days, who you want to impress, who you want to help, who do you not want to burden, how do you want to sleep, how do you want to recreate, how do you want to feel, where do you want to travel, what sports do you want to play, how do you want to play with your grandchildren. If nobody's listened to you in that way, and nobody spent 15 minutes to half an hour listening to your story, it's time. And I need you to click on the link that Chris is going to put in the chat box, so you and I, depending on where you're from, maybe a member of our team can sit down with you for a half an hour and discuss finally what you're up against and what your story is. I hope everybody has learned something tonight that they can take with them. But the big thing is that it's time to be proactive. It's time to make a change. And it's time to let the people that know how to solve this problem help you. Chris has put everything you need to know as far as how to get scheduled in the chat box. Please click on the link. I'm so looking forward to talking to you. Call this number. We have people working still. They'll answer. They know that we're doing this webinar. I'm going to stay the rest of the time now. We're going to open the chat box. And if there's any specific questions, I'm going to do my best to answer them. So feel free to answer. There is a 20-second delay, so it's not going to be right away, but Chris is helping me and we'll get your questions answered. So thank you guys for joining me tonight.
And we have one question from Sue.
Okay.
I have 8 grandkids and I want to be around to watch them grow up. I tried everything and I am fed up.
Okay. And Sue, I don't know if that was a statement or a question. However, I would say that that's our biggest purpose in life, is making sure that we have created a family and we want to be with our family and do the things that our families are doing. And if we have 8 grandkids, I'm sure your grandkids do not want you sitting on the sofa or the recliner, not enjoying them or being in the pool with them or recreating with them. And as much of a statement that may have been, I know exactly what you're trying to get out of that statement. And you want help and you want hope and you want to make sure that there's an answer to this question so you can move forward. Even though it's not going to be overnight success, you're going to move forward. So you know at some point you're going to get better.
Barbara's asking, does this program cost money?
Barbara, this program does cost money. And I think when people ask that question, I get a couple of different questions. They ask, does insurance cover it and how much does it cost? And I will be very transparent. Insurance obviously is set up to prescribe pills and do procedures like surgeries or injections. And we discussed that we're trying to get away from that. So we do not take insurance, and it does cost money. But every client is different. Some people are with us for a month and some people are with us for up to a year. It really matters on what your condition is, and dealing with chronic illness and chronic pain, it's too much of a specific question to answer on this portal. But I would be more than happy to talk to you over the phone to hear your story and answer that question after I hear your story.
Sue is asking again, do I have to come into the office? I don't know if there is one near me.
Sue, that's a great question. Thank you. If you have a structural problem, we would prefer that you were in the region in which we have offices, which is in Scottsdale, Arizona, as well as San Diego. However, we treat majority of our clients virtually. So some we have never met face-to-face, only through an online portal, because what we can do is support through this system, because these pillars are set up in a way in which you are able to learn on a daily basis the steps that you need to take to get yourself better. So you do not have to be with us face-to-face unless there's a very specific injury or issue that has to be addressed. I'm going to wait for another 20 seconds or so to see if there's any other questions. I hope I made an impact. I hope you learned something, and I hope I hear from you. Chris, is there anything that you'd like to say or any parting words?
The program made a big difference for me. I am much happier and more energetic in life, and I hope all of you take the opportunity to learn more.
Thanks, Chris. All right, we're going to shut down right now. Thank you so much. It's time to go. I look forward to talking to you.